Hello, everybody. Welcome to this opportunity to hear from Dr. Stephanie Lind and nurse practitioner Sarah Price with Bothwell TLC Pediatrics. I'm Dana Kelchner. I'm with the Bothwell marketing team. Tonight, Dr. Lind and Sarah are going to address common questions they hear about the Pfizer COVID-19 vaccine that was recently approved for children aged 5 to 11. Earlier this year, the Pfizer vaccine was approved for children 12 to 15. Before we get started, I want to share some information to help our viewers understand the objective of our chat this evening. We know that every person, every family, and every child is different, and deciding to get the COVID-19 vaccine for a child or oneself is a personal decision best made by talking to your healthcare provider. We're not here tonight to tell people they must get their children vaccinated. The providers and staff at Bothwell TLC Pediatrics are experts at administering vaccines to children, and Dr. Lynn and Sarah are sharing their expertise to answer questions and open a dialogue. We will go through several planned questions, and viewers can post their own questions in the comments that may be answered at the end. When we're done, we'll also talk about another way people can have a one-on-one conversation with either Dr. Lynn or Sarah to get additional questions answered. So let's get started. Dr. Lynn, I'll start with you. How does COVID-19 affect children?
Yeah, so fortunately, most COVID cases in children are mild, but some kids do have more severe illness. So currently, COVID is about 24% of the COVID cases are in children. So it's we're seeing just as many cases in kids as in adults. So for the kids who have more complications, about 7 to 8% of them will experience long COVID symptoms. More than 24,000 children have required hospitalization for COVID, and a third of those children did not have any underlying health conditions. And then there's a pretty severe complication of COVID called MIS-C, which is a multi-system inflammatory syndrome. That presents with kids being very, very sick. Most of these kids require hospitalization. About 5,200 kids have developed MIS-C. And this complication is most common in that 5 to 11 age group. And about 800 kids in the US have died of COVID.
Great, thank you for that data. I appreciate that. Sarah, can you tell us how COVID-19 spreads and what does vaccination do to help reduce that spread?
Okay. COVID-19 is spread primarily through droplets containing the virus. So if an infected person were to sneeze or project these droplets containing the virus and you encountered it into one of your portal of entries, we'll say eyes, nose, or mouth, then you could become infected. So that can be if someone coughs or sneezes and you contact that. It could be if you're in close proximity to someone who is breathing and kind of shedding the virus particle, or it can be if you have gotten it on your hands and then you go to touch your eyes, nose, and mouth. That's why hand washing is the hallmark of infection prevention for all respiratory illnesses, COVID-19 included. The vaccine will prevent spread in that it prevents people from being infected with it. The fewer people that are infected, the less likely there is to be spread. There is a caveat to that. What most people hear and ask about is, well, I heard vaccinated people can still transmit the virus. So that's, I did want to talk to that for a moment. So what happens with that is the virus can get into your nose and it can begin replication in your nose or your portal of entry. And during that time while it's replicating, it can also be shed. A person that has either natural or vaccinated immunity will mount enough defense that it doesn't turn into infection. But in that period, when the virus that someone has encountered is in that area, it can be spread just like it does with natural. Vaccine is still protective. Natural immunity is still protective, but that is how, when people ask, why do they still transmit that is how that occurs.
I think it's important to add the vaccine prevents you from getting COVID. And so if you never get COVID, you're not going to spread COVID. But there are breakthrough infections that are still contagious. For those that are contagious, people who are vaccinated clear the virus faster than those who are not vaccinated. So transmission is still lowered from vaccinated people because they're not contagious for as long.
And I think another point too is the variants of the virus, which could also impact, someone getting it again. The virus has changed, it's mutated. That's what happens a lot of time, or it does happen each year with the flu, correct? There's a different strain, and so having that protection for whatever strain is out there is most important. Sarah, we also want to talk tonight about the mRNA technology, which is the technology for how the Pfizer and Moderna vaccines were created. Can you explain that those letters sometimes have triggered some thoughts and concerns in folks? And so if you can help us educate on what that technology is.
Yes. So the science of this mRNA is not new. Its application in this vaccine that is now being used for the pandemic is new. So the vaccine, yes, new. The science, it's been something that we've known and been working with for a long time. So mRNA stands for messenger RNA. Messenger RNA is basically a molecule that contains a code. And what it does when it's in your body is it communicates with your cells, and it allows your cells to create simply the spike protein of the COVID virus. From that point, your body will then recognize that spike protein as a foreign body, an antigen, and mount this immune response. And from there, our amazing, remarkable immune systems will create a defense and create memory. So basically, it's a tool to train our immune system so that our bodies can overcome the infection should we ever be. And that's the same concept as all of our other vaccines. Just previous vaccines, the ones that we use are common childhood vaccines, use actual viral particles, but it accomplishes the same thing. So another thing too to mention that the mRNA, those molecules can't do anything but produce that spike protein from the COVID virus. So it doesn't actually enter the nucleus. It doesn't do anything to our natural immunity. So it's not, per se a gene therapy, and it's not going to alter our genetics. So that's kind of been something that people get confused about, but that's the only thing that the mRNA vaccine can do is code for the spike protein.
Okay, thank you. Next, we're going to talk about specifically the dose for children aged 5 to 11. So Dr. Lynn, can you share how that dosing for that age group is different from the adolescent dose or the adult dosage?
Yeah, so for Pfizer, the adult and adolescent dose is 30 micrograms, and in children, the dose is 10. The children's Pfizer vaccine is packaged separately than the adult. We're not just drawing up smaller amounts of the adult dose. And the vials are color coded to separate the adolescent and adult Pfizer from the child pediatric dose of Pfizer. The pediatric dose is for ages 5 to 11, and then at age 12, you switch over to the adolescent dose. It is given the same way you get your first dose, and then 3 weeks later, you get your second dose. For those kids that they're right at 11, about to turn 12, we do still recommend initiating their vaccine at age 11 versus waiting until they turn 12 and get the bigger dose. If they have their 12th birthday between their two doses, then they would get 10 for their first dose and 30 for the second dose.
That's interesting. I had a question, and I'll come back to it, but I know what it was. Why is Bothwell just giving the pediatric dose at TLC Pediatrics? The adolescent and adult dosage we've been doing in other vaccine clinics and other locations, but why just this age group at your clinic?
So to begin with, our supply is limited, and we want to have it where the pediatric patients are coming. We know that pediatric patients are seen in other clinics too, but we have the pediatric nurses who give childhood immunizations every day, multiple times a day. And they have that experience with kind of dealing with anxiety around vaccines, and just expertise of drawing up the different vaccines and giving them. And then if there were to be an adverse event like an allergic reaction, they're used to dosing medications like epinephrine for pediatric patients.
Okay, great, thanks. So Sarah, I'm a mom. I come in, I bring my child. One of my questions, what are the side effects? What should possible side effects with getting the dose?
Possible side effects for the COVID vaccine are the same as with most other vaccines. That would be fever, headache, body aches, fatigue, tenderness and swelling at the site, a localized reaction. And what those side effects are is basically the body communicating with the vaccine. So although they seem unpleasant, it's actually a sign that your body's creating that immunity. Now, a lot of people have no side effects at all. And then some people will have, basically the first 24 to 48 hours feeling kind of raunchy and wanting to lay around. Of course, Tylenol, Motrin, hydration, those are all things to kind of combat those side effects. But those are things to expect or to kind of prepare for and to know are normal and not means for alarm.
Okay, great. Dr. Lynn, tell me about possibly a more serious issue, and this is the risk of myocarditis from the vaccine that we've heard about.
Yeah, so myocarditis has been linked to the mRNA COVID vaccines. And this has been especially linked in the adolescent and young adult male population, has been the ones most affected by this. It is an extremely rare complication. It happens in less than 1 per 100,000 doses of the vaccine, and typically happens after the second dose. If you separate out that adolescent male young adult population, the incidence increases to about 8 to 15 per 100,000 doses. There were not any cases of myocarditis in the trial of the 5 to 11 year group. It was only about 3,000 children in that group, which is enough to catch the most common effects that we would expect. But for a complication that happens less than 1 per 100,000, you're probably not going to pick it up. But it is something being monitored for after we get more children vaccinated. An important point about the post-vaccine myocarditis is that it is less severe than classic myocarditis. So most people who got myocarditis did require hospitalization, but by 3 months post-diagnosis, they had normal heart function on all measurements, like 75%, I think, were completely resolved by 3 months after. And that's using EKG, echoes, like an ultrasound to look at their function of their heart and symptoms. So classic myocarditis is very devastating. Post-vaccine myocarditis has been much more mild. The other thing about post-vaccine myocarditis versus classic myocarditis, so myocarditis is often triggered by viral infections, and COVID is one of those infections that can trigger myocarditis. So your chance of getting myocarditis is much higher from COVID infection than it is from COVID vaccination. It's about 6 times higher in males to get COVID-induced myocarditis versus vaccine-induced myocarditis, and you're 21 times more likely to get myocarditis from COVID itself versus the vaccine for females.
That's good information. Just again, talking about the risks versus benefits of the vaccine versus getting the actual virus. What do you say to people who are concerned about long-term side effects? We know those are out there. They're called long haul cases. Is that possible? What do you have to say about that?
Yeah, so the risk of getting late onset complications from the COVID vaccine is extremely rare.
not sure if we can hear you. Can did we lose your volume, Dr. Lynn? Sarah, can you hear her?
I cannot hear her.
Okay, all right. I don't see her on mute. Oh, she's chatting, I think. There you go. Are you back?
Can you hear me now?
Yes.
Yes.
I'll just restart this whole thing.
Yeah, just restart, because I think it went out just as you were starting to answer the question.
So we don't expect there to be any late onset adverse effects from COVID vaccination. Vaccine adverse effects happening years down the line just isn't something that's happened in any vaccines prior to now, and we don't expect that to change with the COVID vaccine. So when you get a vaccine, the components of the vaccine are degraded very quickly. And so really we expect most side effects to be within the first couple of days, maybe the first week, and then maybe out to like 4 to 6 weeks, but really we don't expect you to develop new adverse effects from your vaccine past 8 weeks, which is why the study had a minimum time frame of 8 weeks post-vaccine for their study period.
Thank you. Our last question is also for you, Dr. Lynn. How long should we or parents delay vaccination after other vaccines? And then there's a follow-up question to that. So we'll start with the first one.
So the COVID vaccine is safe to give with your other childhood vaccines or with your flu vaccine. You don't have to wait any particular time. The CDC does recommend that you get the COVID vaccine in a separate site than your other vaccines. But otherwise, there's no time period that you have to wait between them. It's safe to administer with your other vaccines.
Okay. And then what do you say to someone who has recently had the virus? Should they wait a certain amount of time before getting the vaccine?
So we recommend waiting until you're out of isolation from COVID, but once you are out of isolation, it is safe to get the COVID vaccine. There's no time period you have to wait after infection. Unless you receive monoclonal antibodies, then the time period is 90 days. Those aren't approved for the 5 to 11 year group, but are approved for ages 12 and up. And then the other exception is if you had that MIS-C complication from COVID, you should also wait 90 days past that.
Okay. So as we said earlier, it's really important to have personal conversations as parents or as individuals with the healthcare provider about what is the right course when it comes to vaccine. I'm not seeing any questions so far that we've gotten on the Facebook page. So let's just wait just a second or two and see if any of those come in. No, not any questions. So we can chat a little bit more if there's anything else you want to add. Dr. Lynn or Sarah, do you have any question, anything to add?
I think one thing that we talked about mentioning that didn't come up is the concern about the COVID vaccine and fertility.
Sure. Yeah.
And I just wanted to let everyone know that studies have been done on pregnancy rates, and there's been no difference between vaccinated and unvaccinated in achieving pregnancy. And that's been on people with no fertility concerns prior and also on women undergoing IVF, that there was no difference in their pregnancy outcomes. There's also been studies on sperm count, and vaccination has not affected that either.
Yeah, that's an important thing to add. I've heard a lot of concern from young women or women of childbearing age, concerned about, or being pregnant, just concerned about it. And so that's great information too. Sarah, you had something I think you were going to say?
Oh, yeah. I just wanted to take a moment to be sentimental and say that we understand that everyone has been impacted by COVID-19, and it can be really hard to make decisions, and you're faced with decisions just when you walk out the door. Do I mask? Do I not? Do I go to this? Do I not? And we completely understand. And there's so many perspectives about this. And some of it is politicized, some of it has different motives, and we know that that's difficult. And we're constantly learning too. So we do try to, we spend so many hours just going through research and updating, and it updates constantly. We're constantly learning new things, especially as we kind of expand this population of people who are vaccinated. And that was another point that I wanted to mention. So there have been close to, we didn't get the final number for sure, but we're very near 1 million, if not more, kids that have been vaccinated for COVID-19 within the first few days of its release to the 5 to 11-year-old. So with that being said, for people who are hesitant, who don't really like the rationale behind the 3,100 kid trial, there is a lot more information to come. 1 million plus people, children for the next several weeks are going to be, they're under, very close monitoring and surveillance. We're going to be collecting lots and lots of data. So we're going to stay up to date on that and be very transparent and communicate everything that we know. And then just the one-on-one conversation is where we do best with talking about this. So that's why you may be surprised that we share a lot of the same concerns as you do. So that's why we really invite that one-on-one time and encourage you to reach out, because we really understand, we really sympathize, and it's been hard for everybody, and we just want you to know that we're here for you. So vaccines for kids is not mandated. We definitely don't see our environment as aggressive or pushy. Open dialogue. We want to hear what everyone's thoughts are. So and then Dana, if you want to kind of share how they can reach us.
Sure. That's a great segue. Thank you. And you're absolutely right. Bothwell is here for patients and for the community, here to listen, here to build trust, and especially when it comes to questions about COVID-19 and the vaccine, and for your family or yourself and for your children. So folks can go online at brhc.org/vaccine, and we've created an online form there which will allow you to continue the conversation. You can fill out the form and state which is your preferred method of communication, email, text, a free virtual visit, or a phone call are all options that folks can ask for to be able to talk to either you, Sarah, or Dr. Lynn, I think, would also be willing to be part of that. And so if people have additional questions or something wasn't addressed here, we encourage people to go to that website, brhc.org/vaccine, and fill out that form, and then be able to have that one-on-one conversation and keep that dialogue going.